Oravec, and we are here once again for another COVID-19 Facebook Live question and answer session. And as usual, we are joined by our incident commander, Russ Blackburn, also the city manager. And today, you're used to us having a special guest at these sessions, but today we have a very special guest, Congressman Mast. Good afternoon, sir. It's a pleasure to see you, sir, all the time, even under difficult circumstances. Thank you for being with us here today. So PSL, just to keep track, we are 42 days in since our state of emergency, our local state of emergency declaration. We had our first case in St. Lucie County on March 21st. As of this moment, roughly 4:05 p.m., based on the latest data available to us, the United States has just about 1,005,000 cases. I should say the U.S. has 1,005,000 Americans with COVID, and unfortunately we've lost 57,812 Americans. Here in Florida, we have 32,846 Floridians with COVID. 1,171 Floridians have sadly passed away. In St. Lucie County, our current numbers are at 239 confirmed COVID cases and 22 deaths. So that is where we are, the big picture and our response. I think everyone is wanting to know about reopening. And in his meeting with the president, Governor DeSantis shared that we're most likely going to see that reopening plan tomorrow, Wednesday. So until then, we're kind of on pins and needles and just waiting. We're all anxious to see that. And I think that's the big news. We're going to be happy to take a number of questions and answers. Mr. Blackburn, do you want to take us through your outline of issues before we kick it to the Congressman?
Thank you very much, Mr. Mayor, and Congressman Mast, thank you for being here as well, Mr. Mayor. There are a number of things that have gone on with city government since March 17th. There are a number of things that have happened, and it's the seat. Number of things that have happened with the city since March 17th. Most important, though, is we've continued to deliver most of our services as if COVID-19 never existed. But there were a few of our services that were impacted by how we follow the CDC guidelines, the use of our boat ramps, the use of our Saints golf course, and that course was ultimately closed, racquetball, tennis, pickleball at our parks and recreation programs. So later in the Facebook Live session, we'll give updates on those areas. And then certainly, as our citizens have a lot of questions.
Thank you, sir. We really appreciate you and the staff working hard, and you did give a very thorough update last night at last night's city council meeting. So tonight and this afternoon, this evening, we're joined by Congressman Mast, and one of the joys of city government is that we are nonpartisan at our level, and we don't have to get into partisan politics. But the reality is, once you go to the next steps up at the county and above, you do have to declare. And I hope that no matter what your party persuasion is, that you really appreciate the hard work of Congressman Mast, because I've been in public service for, I don't know, about 24 years. He is one of the hardest workers I've ever met. He and his team are one of the best at constituent cases I've ever seen. And just want to express my appreciation for you. And I know many people feel the same way, and we know you've been working hard through this whole pandemic as you've worked I feel like your whole career in public service. But thank you for joining us, and the floor is yours.
That was very kind. That was a very kind introduction. I appreciate it. And I guess I'll just touch off on that. Obviously, there's a lot of folks with a host of different issues that they're feeling, from personal health issues to personal employment issues to their personal businesses. And I just kind of give a little bit of an overview on that front to say, what is it that as your member of Congress that we can offer between myself and my staff in terms of assistance for anybody that's watching or is going to share something with somebody watching? And the answer would simply be this: we'll do absolutely anything and everything that we can do to help you out with whatever it is that your situation is. If it's unemployment, even though this is something that goes through the state level, through Tallahassee, if we have to reach out to the office on your behalf, if we have to enter in your information into a computer for you or somebody else because you don't have the access or you're getting booted off the system, we'll go out there and we'll connect with you, and we'll do that. I was in Tallahassee yesterday afternoon speaking with the Office of Economic Opportunity about some of my very serious concerns about what's going on with the unemployment system, about some of the things that I think need to happen there. I've had conversations with them, multiple times a week, every week since this has been ongoing, about things, places I think that we can partner to try to help provide additional services from my offices and help augment some of the places that they're finding difficulty in their office. When it goes to small business assistance, whether you're looking at the small business bridge loan through the state, the Paycheck Protection Program loan, or the Economic Injury Disaster Loan Program, any of those small business loans out there, if you need help trying to find your status, find out if your loan application went through, uploading documents, whatever it may be, let my office know. We reach back out to everybody. There's no form communication where everybody gets the same answer that goes out to people. If you reach out to us on Facebook, by phone, by email, by text, by Facebook Messenger, whatever it is, we will get back to you personally. You can imagine there's a little bit of a stack to get back to people, but we will get back to you personally and do everything that we can to help your issue through there. I was also in Atlanta yesterday, specifically to meet with the Small Business Administration, that is the team that deals with the Southeast region, and get an answer on everybody's loan that's reached out to our office about their economic injury disaster loan. We weren't getting all the answers that we needed, so we decided to go visit them in person and try to get those answers, and we did get a status for everybody. My staff has been calling people with their answers today. And then, of course, on the Paycheck Protection Program loan, if you need help being directed towards, financial institutions, or questions about what's going to be forgiven or not forgiven in that, what can be done at hospitals, you name it, reach out to our staff. Let us know however it is that's best for you to reach out, and we will do everything that we can to help you through this with whatever resources we can reach out to.
And we've definitely seen that here at the city. I've seen it personally. And let me just say, for everyone who's at home and they're hurting because they're out of work, they haven't been able to navigate the state process for reemployment, the Congressman is not in charge of the state's program. The city of Port St. Lucie, our incident commander, our local commander-in-chief, not in charge of reemployment. But we know you're hurting, and we want to help you to the extent that we can. So we are trying to do everything we can to lobby the state to connect you to the decision makers to get help. Is that fair?
I think that's totally fair.
All right, well, we are sorry for any glitches out there in cyberspace. It's our understanding that hopefully the audience got to see the Congressman close, and that we then lost the audience as I was going back to the Congressman and pointing out that when it comes to reemployment, the reemployment system is a state system, so the Congressman doesn't have direct control. The city of Port St. Lucie doesn't have direct control. We are just trying to break down barriers and link you to help. So I think your office is doing casework, our office is doing casework, but it's fair to say that as the federal legislator, as a U.S. Congressman, that you are not personally responsible for the state's unemployment system.
It's very literally true. I'm not personally responsible for the state's unemployment system. Now, there is a federal nexus that we didn't get into before. There was the state unemployment system, and then we passed something through Congress known as the CARES Act. And in the CARES Act, there was an amount of $600 per week for individuals for unemployment assistance. Whether somebody is self-employed, that's something that's a really big hurdle right now. Maybe we'll touch on that in a few minutes. The self-employed 1099 workers are just getting a gut punch in the way that they're trying to get into the system. But so there is a federal nexus. We're trying to find ways to be given access to the system so we can just literally answer people's questions instead of us having to call other people for answers. We haven't been successful in getting that access yet. But whatever you want to talk about, yeah, that's the truth of it.
No, I appreciate it. And one of the things I really appreciate about you is you're one of those types of people that says, hey, don't give me the 99 ways that we can't help the right way. Give me the one way that we can help the right way. And so in our office, we are just literally keeping an Excel spreadsheet of our citizens who cannot access the system, are running into trouble, And we're trying to ask them just some very common sense questions, get the nature of their case, not get any social security numbers or anything like that. We don't want to have to store those. And then in our office, we've been working through Karen Sweeney, who is the aide to State Senator Harrell. And Ms. Sweeney is a longtime resident, has been working for a long time for the people. She's been very helpful in getting people connected to the resource. And I think you're doing something similar. I mean, we've made the pitch, as you stated, I think, when we lost our connection there, that you've made the pitch for something more, given your employees are trained.
Yeah, so like I said, I was up in Tallahassee yesterday speaking to that Office of Economic Opportunity, and it was a tense conversation because if there's a way that we can help the people and it's common sense and our staff is vetted to deal with people's personal information, I think that it's time to push the lawyers out of the way a little bit and say it's time to just allow us to help. And that's not totally being done on this front. Gail Harrell has been making the same questions. I was told that, listen, she's been asking for access as well. You'd like it. I said to you, I would hire more staff on and make them work on that 24 hours a day if that's an access that we were given, but we're just not given that access yet. And the unemployment system is a bad system. I heard the term used, it was called a jalopy, of a system, and that's about as accurate as it gets right now.
Right, and one of the things, I think it's a human instinct. It's certainly played out during this crisis. I think that's a fair statement. I agree with you. Or whoever stated that, it is a jalopy. Clearly, it needs to be better. But casting stones and finding the blame now isn't constructive unless it also comes with a lesson. How can we get better in this moment? Like, there'll be a time to dissect everything, break it down, learn, get better, and move forward. But right now, we just need to improve every single day. We got to focus on constructive outcomes. And to your point, if we could get that broken loose, I'm only one of 5 votes here. Our house is much smaller than your house, but the mayor's office doesn't come with a budget to hire any people. But as one of 5, I've mentioned to Mr. Blackburn that I would be happy to use my 1 vote in support of bringing on professional help or allocating city employees to this all-hands-on-deck moment and just helping people. So reemployment, rental assistance. But let's go to, you brought up this great idea, this great important point of, I think it's called pandemic unemployment benefit or something to that effect. And that is that $600. And you referred to it as a federal nexus. So it's really critical. So normally, reemployment in Florida, unemployment other places wouldn't touch independent contractors, wouldn't touch gig employees, but I think that you and Congress saw that there was a need, right?
So I can go through that a little bit. It is accurate to say, and this is an important problem that a lot of people are running into, so I want to be very clear about it. If you are a self-employed gig worker, Uber driver, hairstylist, somebody that's renting a chair from somebody else, fall into that self-employed in a number of different ways. You're absolutely eligible for the CARES Act, the federal nexus unemployment. You are not eligible for state unemployment. So what is that causing in the state system right now, where people are getting the message that, sorry, you're not eligible for unemployment. Now, all of the unemployment, whether CARES Act or state, is going through the state. So these folks that are independent contractors or otherwise are thinking, hey, the system told me I'm not eligible. I've spent days or weeks applying to this. I've been waiting, in the dark with no answer on this. And it finally came back to me and said, I'm not eligible for this. If you are an independent contractor or self-employed, you are eligible. The state system is denying you. What we were told by the state system, I think this is probably one of the biggest gut punches that can go out there, is that if somebody applied prior to April 4, that is when the system had a real revamp on it, the state unemployment system had a real revamp, that if somebody applied for unemployment prior to April 4, they've obviously been waiting a while, then they have to go in and reapply in order to get the CARES Act unemployment insurance. If they applied after April 4, as of today, this is the understanding. This could change based upon what the state tells us that Department of Economic Opportunity, but as of today, the latest information we were given is if you applied after April 4, in that new system that they put online, they're going to be able to transfer that applicant information to get you the CARES Act unemployment. So I think that's a really big gut punch for people that applied earlier than that. Obviously, they've been waiting a while already. People that are having difficulty getting groceries, providing for families, it's very, very serious. I encourage people, again, if you're in a serious situation, call our office, let us know, we'll find a way to help in that. That's the latest on state unemployment and what's going on.
I really appreciate that. That's new information to me, and it's, to your point, it's very important that people know that, and I'm writing that important information down. And so one of the things I would encourage to everyone who is working with government, trying to get reemployment benefits, keep a log. Get an old-fashioned spiral notebook, put it in your notes in your iPhone, whatever your system is, dates, times, people you talk to, the nature of the conversation, where you're at in the process, what the next step is. Create that log so that we can continue to work this problem so that we do not take no for an answer. So in this case, there's a lot of misinformation out there. So you have people on the internet saying, oh no, a hairstylist isn't eligible. No, you're not eligible for the 275 state dollars for unemployment. But after we get you, I guess after April 4th through the system to your rejection for state benefits, that's when the federal benefits of $600 a week will kick in, can kick in. We just got to keep fighting and get through that process.
Another important point also that a lot of people ask about, it is retroactive as well. So a lot of people that have been in the lurch for weeks on end wondering, hey, I've been putting in my weeks that I'm in for unemployed. It's been 3 weeks. I haven't got this. Is there going to be, on retroactive pay? And there will be.
Is it March 9th or what, something like that? What was that date?
I want to say the date was March 27, but I might be, I think it's closer to March 27 than March 9. I'll see if somebody gets me that information.
Yeah, that'd be great. Thank you for clarifying that. That was actually something I wrote to the governor about one of several issues. Do you want to give us an update on PPP? And obviously there's been another bill, thank you for that provided additional funding to that vital program that's really intended to target small businesses. There's been a lot of news about some of the big trusts and some of the big corporations that got money or were in line to get money and then returned it. But how is that going in the second phase?
Yeah, so Paycheck Protection Program loans, right? It's good because it touches two different fronts. It touches the small business owner that's going to go out there and employ somebody, helps them in a way that loan is going to be forgiven. It's essentially a grant if they use it for the payroll of people that they employ. If they use it for qualified utilities like gas, electric, water, things like that. If they use it for rent or mortgage interest for their qualified business, those are going to be forgiven up to a certain point. Payroll in total, the utilities and other things up to 25% of the loan. I want to say at this point there's over about $650 billion between the two different times that this has been authorized that have been put into this program. I told people as that first tranche of dollars was coming to an end, that I really wanted Congress to be in session, not allowing it to come to an end, but even if it did, I didn't believe Congress was going to say, sorry, you weren't the first 10 people in line, so you're not going to get this assistance. See you later. And that didn't happen. It happened later. It happened too late, in my opinion, but ultimately that assistance did come through, and there's more dollars in that pot now to go out there and help the small business owner to retain their workers, and in a way that's through a great loan that's ultimately a grant program. And my opinion is even if small businesses still aren't the first 10 in line, that there's going to be an opportunity to make sure that they can get that assistance to keep their doors open.
Well, I think everyone out there appreciates any help that Congress makes available. Mr. Blackburn, do you want to give us your top headlines on what's going on with the city and some of the things that you're doing to, I guess it would be fair to say, maximize service while simultaneously ensuring public health and safety?
Yeah, thank you, Mr. Mayor. City Council last night discussed a program that we will be implementing sometime in the next probably 3 to 4 weeks at the most. And that's a rental mortgage assistance program. The council asked a lot of great questions and asked us to come back to make sure that this program is timely, but also accountable. And We're doing this program using some local dollars that we have set aside for affordable housing, but also through the CARES Act that Congressman Mast mentioned, there was an additional allocation of community development block grant funds, approximately $600,000 for the city of Port St.
Thank you, sir.
And so, yes, that's right. Thank you.
We were having a conversation about the good things that CDBG can do, and obviously this is a special allocation,
Yes.
but this is very much within the CDBG's wheelhouse. So it's an example of where federal dollars can really, they make a real difference at the local level. Thank you.
So we're going to be expediting first the regulations, the program criteria, the eligibility for our council to look at and approve to make sure that we are being accountable, but also to get the funds out to those in need as soon as possible. So the general premise of the program is if you, after March, you found yourself unemployed, you have an inability to be able to pay your rent or to pay your mortgage, this program is a short-term rental or mortgage assistance program, would provide up to $3,000 per participant and up to 2 months of assistance, so approximately $1,500 a month potentially. And it's designed to get you through that tough time that we're in right now where businesses are not open. If you're working in a restaurant, you're working in a salon, you don't have a way to make a living right now, and there aren't a lot of jobs available. So we're trying to find, it's a bridge. It's not forever, but it will help you. And it's not meant for that individual who hasn't paid their rent in 5 months. You know, it's meant for folks who really have this interruption in their lives of COVID-19. So I expect most likely sometimes next week, we'll bring that to council to finalize, and then we'll start implementing. There's a limited amount of money available for it, but we think it will be able to address that minimum of 90 people. And we're working to amend our community development block grant plan that will allow the use of the CDBG funds as well. And so it may go beyond 90 people. But it is limited, but it will be very helpful to those people who receive the funds. And we are working hard to make that happen quickly and responsibly. So,
Thank you for that update. What I'd say is that, let's say 90 households, because it's going to be
Yes,
way more than
right,
people,
90
right?
households.
Because not only are you helping the family, you're helping probably everyone who's involved in that relationship. Because you might have a landlord that, because we're not just talking about apartments, we're talking about a house in Port St. Lucie where a family might have thought it was good to have a real estate investment, and so now they bought one extra house, and they have a family, and maybe it was tight for them. So you definitely got more than one person, it's a family, but I think your 90 is built on the 270,000 or so that's coming from the Affordable Housing Fund.
that is
And
correct.
so big picture, we're trying to take this 270,000 from this affordable housing pot that we have locally that was funded by developers paying a fee, right? This isn't city taxpayers at home paying that put the money into that fund. So it's affordable housing dollars. And now we're trying to take this allocation, this special allocation of CDBG dollars from our federal government, who has allocated this money, and the city's an entitlement city. We're trying to pool that together. The 90 households is just that seed money that we're putting into it, because we got to go through some bureaucracy, let's say, and we got to amend our plan and make sure that everything is copacetic. And then when we do, we're going to round up to $1 million, and then, you know, instead of 90, well, it's probably fair to say we're going to help total 360 or somewhere
Yes.
in that neighborhood. And I'd also point out, we had a great conversation last night, and one of the things we were talking about, Congressman, is that we're going to formally ask the governor for his help. Right now, evictions are slated, there's a moratorium on evictions, essentially, and foreclosure actions on mortgages until, I believe, May 17th, pursuant to Executive Order 20-94. We're going to ask him to extend that, or at least to think about what that looks like on May 17th. A lot of, thanks to some, I think, congressional action, if you're a homeowner and your mortgage is held by Freddie or Fannie, then you probably have some forbearance options, some deferral options available to you, but maybe not so much for all the renters out there. So I don't know if you've been working on that, if you've been tracking it, if you wanted to add any color to it, but that's a concern of ours, and we're trying to link this program with this challenge and with these people who are hurting, and we don't want to see a bunch of people kicked to the curb on May 17th.
Yeah, I don't think anybody wants to. You know, I've spoken to lenders big and small, landlords big and small, you know, renters, you name it. The landlords and lenders that I've talked to, they don't want to end those relationships. They want to see them continue. I think what you're speaking about is something that I've paid attention to. A number of others have paid attention to this. It's been handled in different states in different ways. Massachusetts has a longer time limit on it right now than the state of Florida does. So I think there are other states that can be looked at to say, what did this state do, and how did that pan out? Florida has the ability to look at that. The governor has that ability to look at that and try to make an educated decision for the state of Florida. And you know, there's forbearance on other things going on right now. Obviously, taxes up until July 15th right now. That's one of the places where you're seeing that shove off. And then the last point that I just want to give while I'm making points here is that my staff did give me the accurate information a moment ago. They said the two dates on retroactive unemployment pay are the 9th and the 29th as of right now. State may change that, but as of right now, the state is saying retroactively to March 9, federal government to March 29 for CARES Act.
Okay, so March 29th for pandemic, March 9th for Florida. Thank you, sir.
Not to speak for the state of Florida, but that's
what's been reported.
what's been reported.
And I believe that I saw that personally, not from the governor, but I saw it reported on a TV news station and also, a state political periodical that's online that quoted the current czar of reemployment. The governor changed some personnel and he brought in the head of management services or something like that, and I forgot the gentleman's name, but he's the one that put that on the record.
Mr. Staton.
Thank you, sir. Yes. So, Russ, I just want to thank you and the staff, because the council challenged staff, how can we help with, we have a public health crisis, we have an economic crisis, how can we help? And you got to help with the basics, I think, first, food, and then shelter. And so this is the city doing what it can. So thank you. So back to you, sir.
Yeah, Mr. Mayor, I also want to note, and you mentioned those baseline issues that every human needs, shelter, food. We also will be working with the Treasure Coast Food Bank very soon to have a food distribution will be announced in the next few days, and it will occur at the Event Center on US 1, the Mid-Florida Event Center. We think that this will really help some of the people who maybe haven't received your unemployment check yet, or you weren't eligible, but you need a little bit of help on a food perspective. So we'll be looking at that distribution right here in Port St. Lucie. And, everybody would think, well, there's lots of food in America. But if you lose your job for a couple of months, you may not find that you have enough money to buy all the things that you need. So we're hoping and believing that this will help our citizens, and we're looking forward to coordinating the city staff helping to manage this, as well as Treasure Coast Food Bank, which has done a phenomenal job, in our region.
And you can't give us the date for that because I'm sure there's going to be a lot of people. So we'll announce that soon, but it's going to be soon.
It is going to be very soon.
All right, and do you just want to give maybe a brief outline of where we're at with city facilities?
Yes, Mr. Mayor, I'd really like to do that. We declared a local state of emergency on March 17th. It was right after we were hearing from the president, the state of emergency nationwide, and the governor announced a safer at home announcement soon after that. Our focus has been on keeping people safe. We have a number of services that really encourage gathering. They encourage people being together. And so part of what we had to do is look at our services to determine how do we as a city safely allow you and to enjoy your life, but not put you in any danger. And so we made some very difficult decisions. We kept our parks open, but we closed some of the functions in the parks, our playgrounds, our basketball courts, those functions that tend to, encourage 10 or more people being together. So our parks have been open for walking, for running, for picnics. We're now beginning to, with the knowledge we have as a city and how to comply with the CDC guidelines, we're beginning to open up certain services again. Last week or week before last, yes, we actually reopened our boat ramps. We've had a tremendous positive response to our boat ramps opening. Previously, we had seen some individuals using our boat ramps with 10 or more people on a boat. And they, it was understandable, there wasn't much to do, but that endangers all of us. And we're strongly encouraging, and we're seeing people use the boat ramps more responsibly. This week on May 1st, we're going to be opening the Saints Golf Course. Again, following the CDC guidelines, we're going to be, you reserve a tee time online, you pay for your tee time online. We're going to be having separation of tee-offs so that people in the groups, whether it's a twosome or foursome, they stagger so they're not bumping into each other. Again, all with the idea of following the CDC guidelines. And we also, on the 1st, are going to be opening our parks for the tennis, racquetball, pickleball. So those court-type services that typically you can manage without having a gathering, without having a large number of people. And we're continuing to evaluate. We're waiting to hear what the governor might announce tomorrow, whether there's any change in the state's safer at home order. Then we will reevaluate other services. But yeah, we're following the governor's lead, following the county's lead, which had, for a day or two, had a safer at home order. Now that the governor's order superseded the county's, and we as a city will follow the governor's order and have. But I think there's a lot of opportunities for us to look at each of our services on a case-by-case basis. How can we follow the CDC orders to make sure people are safe, minimizing the potential spread for COVID-19, but also make sure a quality of life is maintained in Port St. Lucie.
Thank you, sir. And as we turn to the questions that Port St. Lucie has posed to us, we're seeing some of these dynamics that you just touched on in play. And let's just tease out a couple of important points. One, as far as the response to this emergency goes here in the city, we have never issued a safer at home order. We have only managed the facilities that we own and operate. So this is state-managed response, and it's locally executed, but it's locally executed through the county and the health department. So the state has a health department, but each county has an office. We have the Florida Department of Health, St. Lucie County office, and the Department of Health and our county government, led by the county administrator, who's the county's incident commander. An incident commander is one of those bureaucratic terms, but it's really important in emergency response because we follow the national emergency management system, and we have to go by the book. And so there is a coordinated incident command between the Department of Health, who's led by Clint Sperber here locally, and the county government, led by the county administrator, Howard Tipton. So that's kind of our command structure. And then here in the city, we do as much as we can, but the formal requests for assistance any requests that we made are funneled through the county, which then goes to the state. Fair?
That's correct.
And so that unified incident command, that's going to come into play. So we're going to have questions like, why did we open the beaches? And I just want the people of Port St. Lucie to know that despite my many daydreams, the city of Port St. Lucie stops at the Indian River Lagoon. In fact, we only touched the Indian River Lagoon in 2 places, and we touched the west bank, this side of it, and we never cross, we never make it to the beach. So many of the beaches that we enjoy are actually operated by St. Lucie County, but there's a chance that you go to Jensen Beach or a Martin County beach, and there's also a chance that you go to a city of Fort Pierce beach. But usually the city of Fort Pierce and St. Lucie County are in lockstep, and that was a decision that was made by the county administrator in concert with his legislative body, St. Lucie County Board of County Commissioners. And they made the decision. I shared the county press release. It's also available on their county update page. But big picture, I think that they feel like others do. And let's go to now this really big picture. So we've seen this issue of the response to COVID kind of break into 2 camps over time here. We see people who want to open everything up now. We see that constituency. And there's a constituency that wants to keep it locked down. And Gil Smart, if you know Gil, he's a columnist and really the head of our TC Palm, our local TC Palm editorial board. And he had a pretty, I think, good opinion piece that was printed recently. And he talked about, hey, we know that those different camps are out there, but really we're looking for that pragmatic solution in the middle, because we understand that you can't have public health without an economy. You can't have an economy without public health. I'm old school, so I kind of think about unalienable rights, certain unalienable rights, and among these are life, liberty, and the pursuit of happiness. And for me, it's not like you get to pick 1 out of 3. You know, they all go together, and they're all interrelated. And this is a public health crisis, and it's an economic crisis. And we have to do our best to respond to both. And what does that mean? Well, that means, to me, going back to the city, that we're going to provide as many services that we can without sacrificing public health and hurting people, that we're going to protect people, and especially we're going to protect our vulnerable people. We're going to protect our seniors, our immunocompromised. We're going to measure, we're going to test. We know that we're not going to always get it right as we reopen things, and that's why data is important, that's why testing is important. Everyone who's looking at this as a flip switch I think that's the wrong metaphor. Think of it as a dimmer switch. It slides, and sometimes when you bring the lights on too soon, you got to come back down a little bit before you go all the way up. I think that's where we're at. So I'm going to continue to call on everyone not to go one way or the other all the way, but how might we do the best we can under the circumstances and make it better every day. So that's what I'm going to ask for, and I think you see that play out with every one of these decisions. Why did the county open the beach? Well, if you want to know why the county opened the beach, you could call your county elected official. But I'll bet you $1 that it was because they wanted to provide as much as possible to the citizens without putting them in harm's way. So they wanted people to be able to enjoy the beach, be able to enjoy their parks, be able to enjoy the ocean, be able to be healthy, provided they followed common sense social distancing guidelines like staying 6 feet apart, and they didn't put each other in danger. So the idea is not to lock someone in their house. The idea is to lock the virus away. I don't know, any other color on the big picture?
Yeah, I mean, I think one of the easy places to point to this when we talk about it is to say, certainly at the federal level, our country was not designed for the federal government to go out there and manage the risk of every individual. That's not the way that our system was set up. But even more importantly, it's important for all of us to look in the mirror and say, how do I best manage my risk? Is it the time that I spend out in public? Is it the distance that I keep from people while I'm in public? Is it some kind of shielding that I put over myself to limit my exposure to something that might be traveling through the air? And we all have a much greater education on what that can be today. But in the end, we have to be able to go out there and wisely manage that for ourselves and not totally lean on government to do that for us. You know, if we look back to pre-COVID time, you can say the doctor will tell you, listen, you need to stop smoking, or you need to eat less, or stop eating bacon, or you know, drink less, or whatever the case may be. And there's a take it or leave it in our life. And in this, we have something that affects the health of others, so we need to both judge wisely for our own individual health and the health of the individuals that we love, whether it's our parents or our grandparents or friends that we have or people we know that might have cystic fibrosis or some other illness that's affecting their autoimmune system. But in the end, we have to go out there and look in the mirror and be the best managers of our own health. Nobody's going to take better care of our health than ourselves, in my opinion.
Thank you, sir. Do you want to touch that one, or you just leave it to the politicians?
I'm going to leave it to the politicians, Mr. Mayor.
Thank you. And but I take heart in that concept, Congressman. So no matter what a government may or may not impose upon us, no matter what another person who kind of invades my space when I'm at Sam's Club, like if this is me and this is you and we're starting to get close to the force field, I don't like it when someone else goes in that space right now, especially if they're not masked. But no matter what a government may impose on us, may or may not, no matter what another person may or may not impose on us out in public, I take heart in the idea of self-reliance and doing the right thing for myself and my family's ability to do the right thing. So my wife is immunocompromised, and that means that we want her to stay at home. We know that she is a member of the vulnerable population. So we know, based on the best information available to us and the best expert opinions, that this disease has a disproportionate impact on the elderly and the immunocompromised. So based on that, she's going to continue to telecommute. She's going to work from home. And I got to tell you that today, Alex, who gives his regards, my firstborn son, who is a big fan of yours, he was kind of hemming and hawing about going and getting some meat from Aldi. I'm sorry that I'm outing you, Alex. And Tanya was like, do you want me to go? And I was like, no, in slow motion. No, you got to stay because we're going to do what it takes. And when I go home after we're done here at City Hall, I'm going to make sure I wash up, that the clothes go where they need to go, and that we can limit her exposure. That's what we're going to do. And no matter what the governor says in the plan tomorrow, we're going to hope that it's measured and that it's prudent and that it incorporates public health advice. And given that he just didn't throw something out last week, I think that's a fair hope and expectation. But based on the president's opening up America again guidelines, it has what the federal government defines as vulnerable. Vulnerable don't get to go back to the normal life until phase 3. That's in the president's guidelines. So that guidance is already there. So, that kind of common sense advice, make sure you do the right thing, regardless of what happens with nail salons. If you're vulnerable, follow those guidelines.
Understand your own personal risk and manage it well. I think we're trying to say the same thing on that front. I think about people that I knew, before people ever talked about COVID, who I have a friend that was waiting for a lung transplant. And for months, this person wasn't going to meet me in a restaurant. They weren't going to go sit in a place that had a great number of people around. One, just because he knew what his risk was in going out in public and being exposed to that. And that's something that, like I said, we need to look in the mirror and be aware of what our risks are and manage them accordingly.
Yeah, just because you can go to the grocery store now doesn't mean you necessarily should if you're in one of those high-risk categories. There's a difference between what you can do and what you should do. So there's another big picture issue in play here in these questions, and that's testing. And, I always feel like as mayor, my job is to tell people what they need to know, not necessarily what they want to hear. And this is a tough one. And if you watched the city council meeting last night, you know that I had some, I hope people think it's tough but fair questions for the manager. I don't miss the governor's press conferences. I watch every one of them. I look at all the things that come out. I religiously track the Florida Department of Health data that's made available online. And today the governor is reporting that Florida is doing about testing 1 in 60. So for every 60 people in Florida, there's a test. And I'm sure that is true based on the numbers. And I know that he's supported increased testing. He's said it again and again. Unfortunately, from the front lines here in Port St. Lucie, and as we're going to see in these questions, that testing is not playing out in Port St. Lucie. So right now, based on the data, the lunchtime update on the Florida Department of Health site, the state may be at a test for every 60 people, but here in Port St. Lucie, we are one test for every 104 people, and we still have symptomatic people who can't get a test. So, Mr. Blackburn, what are you doing to help get us to that Florida standard?
Yeah, Mr. Mayor, our role is primarily to advocate at the city level. The county EOC, Emergency Operations Center, is really coordinating with the state EOC. We've repeatedly asked for tests in St. Lucie County, in Port St. Lucie. When there are tests that have been delegated to the St. Lucie County Health Department, they then distribute those tests to Cleveland Clinic, Tradition, St. Lucie Medical, and Longwood. And each county health department director is doing the same for the hospital facilities within their jurisdiction. They also make some available for private medical providers. So what we've seen is, because the number of people that were ill have been driving the allocation of tests, that we've seen higher numbers go to those metro areas, Miami-Dade, Broward, Palm Beach County, some in Tampa, where there have been more total numbers of COVID positive people or COVID symptomatic people. That's where the tests have been going. Unfortunately, that's not helping our residents. It's not helping our residents in the city or the county. And we still don't have the testing, the number of tests that we need for our community. We are continuing to push with the health department director and with the county administrator, trying to get our request in. So far, we're starting to see some additional testing, but not the numbers that we need.
So I think we did 73. We got 73 more test results between yesterday evening and today's lunchtime update. So I don't know how many more will be updated with the evening update. But going back to big picture, I think this needs to be addressed. And if you look at going back to some of the arguments on either side of this, and again, please do not think that we have to make this false choice of one or the other. We want both, and both sides should want testing, because testing shows if you're having to take a step back because you opened, but now your infection rate and your spread has gone up and you have more sick people. Testing helps tell you if that's the case, and then you can throttle back, you can dim the light switch, the dimmer switch. Or if you're over here and you just want to open everything up, well, it supports your argument of opening everything up if you can show that more people aren't getting sick, that you don't have a problem. So common ground should be testing, and the fact that, so one of the things I've been doing, Congressman, and we haven't talked about this in detail in a while, but I've been looking at the 25 most populous counties in the state. Obviously, you know, there's 67 counties. I've been looking at the 25 most populous plus Martin County. So I have a group of cohorts here of 26. And based on yesterday's 130 numbers, St. Lucie County was 25th out of 26 for testing per capita. And looking at deaths per 100,000, we're actually the 7th worst. And another thing that I noticed in here is that Manatee County is the 26th of 26 for testing. And yesterday they were 2nd for deaths per 100,000. And as I'm thinking about theories to be tested, one of my concerns is that these regions, small to mid-sized regions that connect in our bedroom communities to larger urbanized areas, are we being left behind? Are we being missed? And I point this out that the Treasure Coast, where Port St. Lucie is the 7th most populous city in the state, but here we are in this region, we're in a county that only has 320,000. So we don't compare to the need Miami-Dade, Broward, Palm Beach, or even Orlando metro area, Orange County, and Tampa metro with Hillsborough and Pinellas. but we connect Central Florida to South Florida. We're a better community to Palm Beach, which does have a high rate of cases and deaths per 100,000. And then Manatee, you could make the argument that Sarasota, Manatee, they connect Tampa to Fort Myers, Cape Coral, and Naples. So we're not big enough on our own to get the resources, but we're approximate, and we may be seeing, that cross-pollination. But, if you were the mayor of a city and your county was 25th out of 26th in testing, would you be happy?
No, probably not. You're never happy unless you're number one.
So I don't know if this is something that you could look into and help, but I really feel like all of us need to call on our our county leadership, our state leadership, and work on this, because testing is part of moving forward.
Oh, I think, you bring up a good point about what the actual numbers are, data-driven. And you're always very good at being data-driven. You do an outstanding job with that across the board. I'm always pleased with that. I think some of the stuff that we look at is the way that the federal and the state are operating down to the local region. And the best way I've heard it put was like an air traffic control system. The federal, FEMA, and the emergency managers there taking those dollars that are allotted through Congress, using the air traffic control system to get them down to each individual state based upon what FEMA is being reported as for those needs, and then those state health agencies being the air traffic control towers for their state, and taking, whether we're talking about test kits or masks or hand sanitizer or whatever the item is that is in need, and trying to go out there and be that air traffic control tower for that. And there's no question, sometimes there can be failures in it.
So we always appreciate your help, and you're one of the most passionate advocates a city or a community could have. So I look forward to speaking with you more about this, and hopefully calling on our leaders who can actually help and get us additional resources. I will share one of the ideas I shared with the manager, and on Saturday, Governor DeSantis was at Cleveland Clinic Weston, and that's where the press conference was. And just if we can just, in the midst of this, have this proud moment, share this. Dr. Barsoom, the head of Cleveland Clinic Florida, he is sharing with the governor everything Cleveland Clinic's doing, everything they've learned, the great response they've had with their artificial lung. It's way more effective than being intubated and being on a ventilator. The success rate has been astounding. But he's sharing all these great things that Cleveland Clinic has learned and all the things they're doing. And of course, he shared the announcement about their emerging pathogens program, and that they're going to be doing research to fight COVID-19 and other dangerous infectious diseases. And they're doing it right here in Port St. Lucie at the Florida Research Innovation Center. So we got name dropped at this press conference, which, if you're from Port St. Lucie and you're PSL proud, you're like, yeah, that's our city. We're gonna fight this war. We're gonna be, this important point in this global war. And so that was a moment of pride. But getting back to the bigger point, clearly the governor has a relationship with Cleveland Clinic. Clearly Cleveland Clinic is in our neighborhood, in our city. They were one of the first to do drive-through testing at the very beginning when that was rolled out. So is there a way that we could work with the governor's office in Cleveland Clinic to provide that drive-through testing center in a different type of region? The governor has brought up the idea of additional testing and going outside these huge population clusters like Central Florida, multiple South Florida. He was talking about maybe a Tampa Hillsborough one, which they're obviously larger. But how about the Treasure Coast? Wouldn't it be great to have one of those centers where any symptomatic person can get tested without checking all those other boxes right here in PSL? So whether that's through Cleveland Clinic or through the state directly, Mr. Manager, that's one of the ideas I floated that I hope you'll pursue. And especially if there's something to this idea that the small to mid-sized regions that interconnect the more populous areas of Florida may need a little bit of help, because we're last for testing and we're in the top third, the top quarter, the top 10 for deaths per capita. So it would make sense.
I'd make a comment on this. It's important when we're policymakers not to necessarily make policy on outliers, but be data-driven. So this isn't an outlier statistic, but it's important also to mention as we're talking about the testing, but also what kind of testing, are we doing? I'm in constant contact with our hospitals from Lawnwood and St. Lucie Medical Center to Cleveland Clinic and Jupiter, Palm Beach Gardens, all of them across the district. And one of the things that you do hear across the board is where they are sending their tests to. Are you getting the rapid test that takes a few minutes? And if you're taking that rapid test, the number of false positives or negatives that they're getting on that, and so versus the ones that they're sending into other places, it's also important to realize which ones that you're getting to get the most accurate information. On a plus side, on speaking to all of those medical centers, I'd say this, that most of them are sitting around 50% occupancy across the board, which is a very big positive when you talk about not necessarily for their business, but for the amount of space inside of these facilities due to the fact that they're not doing elective surgeries pretty much across the board.
And it's fair that probably elective surgeries are going to come back.
They are. This is an important conversation that's going to be had certainly in Washington and probably in other places when you hear these medical centers. And we'll make a comparison between New York and Florida right now, right? New York and New Jersey, some of the hardest hit places. Now, being the hardest hit with this, economically speaking, for a hospital, they're receiving those dollars coming in from Medicare or Medicaid or whatever it is because they're seeing a lot of patients as a result of what's gone on with that. If you have an area that hasn't been hit as hard, then you were not doing any elective surgeries, but you were also not having patients coming in that were, let's say, somebody on Medicare or Medicaid or receiving some other kind of assistance for COVID-19. And so when we're talking about legislatively and in government, where that assistance that's been earmarked for hospitals actually goes, that's going to be a big part of the debate is who needs it more? Is it the hospital that's done more cases but has had more business, or the hospital that adhered to everything, closed everything down, and ended up not seeing a spike? And that'll be a good debate in D.C.
And I'm kind of thinking here at the local level with the governor's order, I think the elective surgery order went to May 8th or thereabouts, but I wouldn't be surprised if tomorrow in his reopening plan that he addresses that earlier. It's been hit on all of the recent press conferences at the hospitals. That's just speculation. We'll see. But as to the different types of testing, certainly you made great points, Congressman, and we should all advocate for economical, free, or very inexpensive tests that are non-invasive, fast, that you can get. They're accessible, and they're reliable. These are the things that we should all be looking for, and that's on diagnostic testing. So we have some questions about antibody testing, and so there's diagnostic testing, there's surveillance, aka sentinel testing, and then there's antibody testing. And with antibody testing, it's to see if you have been infected and potentially are immune to it. But let's put an asterisk on that question, or on that issue, because I think it's an outstanding question on whether you can be reinfected by this thing or not. And it's one of those outstanding questions that we have up on the board here on whether you can get reinfected or not. But does anyone have any info on the antibody testing? I just happen to know someone in our community is offering it, but it's like $125 a test, and it's not covered by insurance. You have to pay for it. Does anyone else have any information?
Lowest I've seen it, I want to say, was $50 or $75. I know that there are some people, I think one group I saw was Hog Technologies, which is in Martin County, offering that testing. Private entities that are going out there and trying to offer something in this fight, and in that it being the antibody testing, or some places the test with the ask that if you test positive that you contribute your blood and your plasma.
Mr. Mayor, what I've read and seen is that some of the private entities, the large pharmacies nationwide, are beginning to offer those plasma-related antibody tests, and I have not seen whether those are offered in Port St. Lucie and St. Lucie County at this point, but I would assume they'll begin to make them available.
So again, there's at least one private provider in St. Lucie County that's offering it, but it's over $100. And so I know in our household, we're not going to go voluntarily take that test. But there are private providers. If you were lucky enough to be included in a study, you might get it that way. But look for more information to come out. And I know it's frustrating that you just can't know, and we can't know all the answers to these important questions right now. But as the governor unveils the reopening plan, we should expect testing to be a component of that, or something that moves forward right after the reopening plan. So there will be additional information. I think it's fair to think that this will be part of the state response and recovery effort. So we have questions on here from people like apples and oranges. Why are we opening? So that goes back to, it's not a public health crisis alone. It's a public health crisis and economic crisis. And you're going to, I think, continue to see policymakers try to find the right balance. Let's see.
Mayor.
Yes, sir.
I see one of the questions from Tammy here, and it's a great question, very specific to the city of Port St. Lucie. We, throughout this COVID-19 emergency, we've been working with partners, whether it's the county, it's the Boys and Girls Club, it's Career Source, all to leverage, the services we provide, make sure our community is well cared for. So one of the partners that we're working with is the Boys and Girls Club. And they approached the city and our Mid-Florida Events Center about the idea of having some of their summer camp programs in the events center. We scratched our head at first, is it possible? Is it possible to do it safely? And we have been looking at, we have very large rooms that we can have some division in those rooms. We have looked at our rooms. How can we have smaller than gathering size, smaller than 10 children groups? Working with the Boys and Girls Club, how do we allow our venue to be able to provide a much-needed service of summer camp for kids in our community? And it's, we believe that we can do it safely. That is the number one priority for the Boys and Girls Club. How do you provide a safe summer camp? We also, as a city, are looking at our own summer camp that would start in June, so about a month later. Also in the recreation part of our events center and in the Minsky Gym. But it is hard. The questioner is right. These are little children that sometimes rush up to people and give them a hug. That violates those social distancing ideas, but we can't stop everything we do. And so how can we safely in small groups, not big groups, with supervision, with counselors that are trained to make sure we keep the kids safe and our counselors safe? How do we provide those services? And so we're giving a lot of thought to how to do that with the Boys and Girls Club. They have been running an after-school care program since early in the winter throughout the COVID-19. They have a good deal of experience. We're learning from them, and they'll learn from us when we start in June. We will do everything we can to prove to our employees and the community what the plan is for keeping everybody safe. It's a great question.
It is, and it ties into the bigger picture once again. And so the idea is not to stop everything or to lock everyone in. It's to minimize the spread, to minimize the number of people who get sick, to protect the vulnerable. And so is there a way that can be done and still go about life at some level, at some new normal? That's really the challenge. And I find myself thinking about math. And so when we learn math, we don't start with algebra or geometry or trig or calculus. We start with arithmetic. And we learn the basics, and then we go from there. So we know that if you're vulnerable, if you're meaning elderly or immunocompromised, it's probably best for you to stay home. And then we know if you're going to be in a place where you can't maintain at least 6 feet, and you got to wash your hands and not touch your face, all that good stuff. It's good to wear a mask. I wear my mask every time I go to Sam's Club. But there are things that the CDC has said can help in this. In addition to social distancing, it's screening, right? So screening the kids that come in, making sure that they're not running a temperature or showing any symptoms. It means staying home if you're sick. It means screening the employees. And it means a different level of cleaning. and it means occupancy load on the building, and a whole long list of things that are more nuanced. So it's not the basic of just stay locked in your house. It's kind of like calculus. So now that we know that we have this foundation, that we can have immunocompromised and they're safer here, are there things where people who don't have that same risk profile can do other activities in services while still being safe? And I think that's where we're at. But then I go back to the testing, because if you're really being data-driven and you're really watching this, as you change your procedure and what you're allowing, you should also be measuring to make sure that you're moving in the right direction. And that's why I continue to advocate for testing. But with all of our things, with the boat ramp, with tennis, with golf, it's social distancing, it's hygiene, and then it's screening and cleaning. And when we say cleaning, we're not talking about cleaning just our cans. We're talking about cleaning the equipment, cleaning the walls, cleaning all the high-touch surfaces. And so, and that hits Jacqueline Surloff's question also about the length of the shutdown. We shouldn't be fixated on a number on the shutdown. We should be fixated on what's happening in the community with the spread of the disease. And by all indications that we have, we're in good shape. So even here in St. Lucie County, where I would like to see us do better, our beds, our hospitalization rate, there's plenty of capacity within the healthcare system to deal with additional cases. Now, I can tell you why I don't like that, and we just had this conversation, is that hospitalization is a lagging indicator. So right now, we're in the neighborhood of 60 hospitalizations. If all of a sudden tomorrow we're at 80 or 90, even though that's only an increase of 20 or 30, it's a big deal from a percentage standpoint. And that's a problem, because hospitalization, you got sick 2-3 weeks ago. So that's a lagging indicator. So better to be indicated by testing ASAP on the front side before you get to hospitalization, because that hospitalization, you're already playing from behind. But right now in St. Lucie County, we know that we are in good shape on hospitalization and healthcare capacity. Thank you to all the hardworking healthcare heroes out there and everyone else working hard to make a difference. We're good there, and we know that based on flu-like symptoms and some of the surveillance that the state does, we're in good shape. So let's see. Will we be providing masks and gloves to the public because we can't find any to buy? So on the N95 side, we're still behind. And I don't know, Congressman, if you want to jump in on this one, but this is a pet peeve of mine, because we like to talk about all the tests we're doing and all the PPE that we're distributing, but we don't always talk about how many masks we need. So the burn rate on PPE nationally is 300 million N95 masks a month. So then when you start talking about 5 million shipping here or there, you're like, oh, that's not a lot. And now we understand why we're having to worry about reusing and why we can't get first responders to have N95, let alone residents at home. I don't know if you have any thoughts on that one.
Again, this just goes back to speaking to our hospitals and different communities, and I'll just touch this mainly from speaking to all the medical centers that I've been able to outreach to week in, week out. They're not totally where they would want to be in a perfect world, but they've been pretty clear across the board, though, that they're not where they were 3 weeks ago, where it was this crisis situation. They're seeing stockpiles come back up as a result of not doing those elective surgeries, as a result of not having the anticipated beds being used in the hospitals, in the way that many of them have quarantined off certain people working on certain floors. Many of them are telling me that if, for these medical institutions, that if somebody's coming in, they have enough to make sure that if somebody's coming in as a patient that broke their leg or a patient that has COVID symptoms, that they're able to give everybody a mask that's on their way into those places. So speaking at it from what I've heard from our medical centers, things are coming up in the right direction.
And thank you, sir. And Mr. Manager, do the city's first responders, let alone then the public-facing members of your staff, do they have enough PPE to follow proper PPE protocol where you get it dirty, you should throw it away and start with a new one?
No, Mr. Mayor, we don't. However, similar to Congressman Mast's comment, in our police department, everyone has been issued at least one N95, and if that one should be soiled or wear out, we get them another one. We'd love to have one where they can wear it for a day and throw it away, but we're not at that point yet. And it's similar to testing. We request those PPE masks through the state EOC system. And unfortunately, they've been sending them to areas with higher incidences of COVID-19. But we have enough that we feel like we can manage our risk reasonably well. For other employees who are not accidentally engaging with folks who are COVID-19, we're also seeing that it doesn't have to be an N95 mask. You can have a facial covering. I've seen people with bandanas where, and homemade masks that are very effective. There's one right there.
Yeah, with the city seal on it.
And so it depends on the kind of risk that we have, what kind of mask you really should be using. But the question that Ms. Prince mentions, that, we really actually, we can make masks ourselves. We can use different cloth type tools. May not be the store-bought mask, but we can have an effective facial covering that protects, if we have a cold, if we have, something, it protects other people more than it protects us, but it definitely protects other people. And so I think as we, that's one of the things is if we see, and I expect we will see at some point soon, the Safer at Home order being lifted at least in phases. And we would strongly encourage every citizen of Port St. Lucie, if you go out in public, wear some kind of facial covering. Wear a facial covering. It's very effective. We have seen that. The CDC recommends it. The president has recommended. Everybody who's really looked at this issue says it doesn't have to be an N95 mask. Just a facial covering is very effective, and we strongly recommend it.
So when you're dealing with the math of spread, cutting off a couple of transmissions makes a big difference over time. And so everything that we can do to improve and to protect is going to help in the long run. But Sharon, what I would say is you saw the dynamic. So Congressman Mast shared what's happening at the hospitals. If they continue to be under trend, if there's not the surge that was originally forecasted everywhere, and we can avoid that, then supply has been ramping up, right? We've been talking to 3M, the federal government has been talking, and others have been talking and saying, hey, max that out, make as many masks as we can make. And so you have supply ramping up. As that happens, then the hospitals can get what they need, then the first responders and the essential services will get what they need, and then it'll become readily available. And I would love for the people of Port St. Lucie to be able to use an N95 mask right now, but we're still in a state of rationing, just like we are with the test kits. So with tests and PPE, we didn't have enough supply. We're having to ramp up. We're having to play catch up. And we'll get there, but we're just not going to get there as fast as we wish we would have. So just stay in there. Now, if you would like a cloth mask and you don't know how to make one, and there's some templates available on the CDC site for T-shirts that you don't have to sew. But if you would like one like, not necessarily like this with the city seal, but I'm sure that we can hook you up with a cloth mask. If you'll just email me at mayor@cityofpsl.com. We'll make sure we get that for you. As the gloves, a lot of times gloves will give people a false sense of security, is what experts have advised me, and that the best thing that you can do is to follow good hand washing protocol. Most people, unfortunately, they haven't been trained, and like gloves seem really intuitive. You just throw them on, but there's a process. And if you wear them all day, I don't know if you've seen any of the photos. You see a guy eating Doritos with his gloves on in the grocery store line. That's not going to work. So better than that is to never touch your face unless you do it with a tissue. And it's amazing how itchy your face can be when you know you can't scratch it. And just to do that and to wash rather than wear gloves. And no matter what, please do not litter your masks and gloves in parking lots around PSL. I know that no one watching right now would ever do that, but there are people who do that, and please convince them not to. All right, well, I think we've answered all of the pending questions. And any closing comments, Congressman?
Sure. I mean, if you want a closing comment, I look back to my days as a bomb technician. How did I protect myself from an explosive device, which obviously was not totally foolproof, but...
I just touched my face, darn it.
Sorry. But we called it TDS, time distance shielding, right? The amount of time that I spent over an explosive device, the more risk I was at. The distance, whether it was 6 inches or 6 feet, makes a world of difference in terms of the level of safety for you, and the kind of shielding that you have beyond that makes a whole world of difference. And for me personally, I look at managing my risk for COVID in the exact same way, time, distance, and shielding.
Well, of course, we're very sorry that you had that interaction with an explosive device, but I am very grateful that you're still here with us, and you're the kind of guy that you are. Thank you for your service. We really appreciate you. Mr. Manager?
Mr. Mayor, I think it's easy to see that in time the safer at home order will be lifted. We don't know exactly what day, but there's going to be a tendency to want to go out and go to Walmart, go shopping, go to a restaurant. I expect the governor will phase those openings so that we try to comply with the president's task force recommendations. But ultimately, we do have to make individual decisions. And, wearing a mask is one that we would encourage folks to seriously consider. Wearing a facial covering, it doesn't have to be a mask. And then recognizing if you're at risk, you may not be the first to be in the restaurant. You want to really think about what is your level of risk as an individual, and how can you enjoy the freedoms that we're lucky to have, but also do that responsibly. And so as a city, we're trying to look at our services. How do we open more services up, but to do it responsibly so we don't inadvertently, cause too many folks to perhaps gather or cause an issue for COVID-19. So that's our challenge as a city, and we hope that we will be wise in our decision-making, but it is certainly, we can't do it alone. We need your help too as an individual. Make those good decisions. How will you use the services we have, not only as a city, but our entire community?
Thank you, Mr. Blackburn. Thank you again, Congressman. Thank you, Port St. Lucie. I'd like to thank just all the healthcare heroes, the first responders, and the essential workers. So I love thanking the healthcare workers. I love thanking the essential workers, the first responders. But in those essential workers, I just want to make sure we don't miss the truck drivers, the farmers, those bag boys. I was once a bag boy back in the day that, doing their job for minimum wage and keeping society running. We just had Nurses and Healthcare Professionals Week. Next week we have teachers, and teachers are having to adapt and evolve. And just thank a teacher out there also. Thank you to everyone who is trying to cope with the situation. In Florida, we know that there's a price of paradise. We're used to hurricanes and other natural disasters. We're not used to hunkering down for 42 days. And it's hard, and it's stressful. And who doesn't wish that we could go just back to how it was and to flip the switch? But it's not a flip switch. It's a dimmer switch. And so no matter where you're at in the debate, whether you want to open full throttle tomorrow or you want to keep it locked down, no matter where you are, I hope that you understand that you have common ground with your neighbors that are on the other side in testing and being data-driven. Because everyone should want life, liberty, and the pursuit of happiness. Anything less than that should be unacceptable to every American. And you can always reach us at the council office, city council. I'm just a ceremonial head. I'm part of a greater team not just the administrative side, but a city council. They're all working hard for you. You can reach us at 772-871-5159. 871-5159, all right? So please give us a call. Email address is mayor@cityofpsl.com. Reemployment's the state. We don't care. We will try to link you to state resources and help you, just like this hardworking public servant over here in his office. We're working on a rent assistance program. We won't be able to help everybody, but I bet we'll be able to help over 300 families and then some. We're working with our partners on food. In addition to Treasure Coast Food Bank, who's incredible, and St. Lucie Public Schools, remember they're feeding families, and the Boys and Girls Club is too. We're gonna have the food giveaway with Treasure Coast Food Bank, but also, I hear it works better than reemployment, SNAP. Some people might know that as food stamps, but SNAP, I'm hearing, works great, and if you're eligible, you can get connected to resources. In the council office, we have a strategic reserve of TP, so if you need the most basic of necessities, contact us and we'll be there for you. And we'll get through this thing. We will respond, we will recover, and ultimately, we will prosper. Thank you. Thank you. Thank you, PSL.